Our topic this session is diabetes and relationships, and I'm joined by medical student Mark Anderson. Thank you for helping us with this topic, Mark.
Absolutely. Glad to help.
Mark, what do you think our listeners should know about diabetes and relationships?
A lot of research has gone into looking at how the experiences and interactions we have with others can affect our health as we go through life. Can our relationships and social interactions really increase the risk of diabetes or make it worse?
Yes, absolutely. The unfortunate reality is that not only do our current social situations affect our health, but research shows that our past relationships and social interactions can greatly affect our health today. Numerous studies have shown that our current and past social situations can affect our risk of disease like heart disease, obesity, depression, anxiety, substance abuse, and even cancer, in addition to diabetes.
That is fascinating. Are there any specific examples of our past social situation increasing our risk of diseases, in particular diabetes?
Yes, there are. One really powerful example of how our relationships and interactions with others can affect us in the future is adverse childhood experiences, otherwise known as ACE or ACE scores in research.
What's an ACE score and how does it affect our health?
An adverse childhood experience, or ACE score, is a number score for the number and type of adverse experiences that someone experiences as a child, like trauma, neglect, abuse, poverty, and homelessness. Basically, the higher the number, the more unfortunate events and situations that person experienced as a child. High ACE scores are associated with increases in a person's risk of numerous chronic diseases as adults. Additionally, adverse childhood experiences also significantly increase a person's risk of things like smoking, risky behaviors, being in prison, substance abuse, anxiety, and depression. If we look at diabetes, adverse childhood experiences in general raise the risk of diabetes by 32%. And child neglect, the most common form of abuse, can raise the risk by as much as 92%.
Wow. What causes this to happen and how does that work?
Good question. We still have a lot to understand about the underlying processes, but what we do know is that the relationships and interactions we have with our family, friends, and others can actually alter the way our genes are expressed and change the way our body functions. To illustrate, in those who have suffered significant adverse childhood experiences, we consistently see high levels of certain chronic stress-related increases in triglycerides, fatty acids, insulin, and glucose, all of which can contribute to metabolic syndrome and diabetes. We also see consistent differences in brain chemistry, learning, and stress coping skills, and people learn bad habits and dysfunctional ways of doing life. It is a complex problem with many factors involved. We hope that as we can understand more, we can better intervene and prevent these problems, giving patients the best chance for recovery and a successful life.
So how can we use relationships as part of lifestyle medicine treatment for diabetes?
Studies show that social support and emotional well-being are linked to better diabetes self-management, fewer disease complications, and better overall outcomes. Other research shows the flip side, that when these things are low, the diabetes problems are bigger. Despite this evidence, contemporary healthcare falls far short in sufficiently identifying and addressing these important aspects of patient care in diabetes. Now, to be fair, treatment can be challenging and often requires long-term interventions that may include things like personal and family therapy, social support groups, community services, and of course, the core lifestyle interventions like diet, exercise, stress coping skills, and sometimes substance abuse counseling, in addition to medically treating the diabetes and/or other medical problems.
Wow, this seems like a much bigger deal than most patients or doctors realize.
Exactly. The science shows that healthy relationships and social well-being are paramount to not only mental health, but also physical health. Anyone who has ever suffered a bad breakup or divorce, lost a loved one, been bullied, shunned, or felt alone in the world can attest to how much physical pain or other symptoms are felt, though no physical harm is actually done. Your stomach churns, you lose your appetite, and so forth. Your physiology is changed. On the positive side, the warmth of a hug, the love and support of family and friends, the connection of community and feeling like a part of something bigger than yourself makes you feel good, strong, energized, your physiology is changing for health and for long life, including improved metabolism and blood sugar control for diabetes.
Wow, that is fascinating. Thank you so much, Dr. Braman. I will definitely be using this information to help me treat my diabetic patients by fostering strong relationships and improving their emotional well-being.
Excellent. Thank you, Mark.